What a pleasure to be here with all of you. And let's get right into it before any more of my precious minutes are utilized. So, hold on. Okay, so for our time together here, I want to just cover a couple of sections. So we'll go back in time and review who we are as an organization, but very specifically about where we started this work. I think that's an important part of kind of putting all the pieces together. We'll share with you how we went about doing listening sections and sessions and what we heard from those and how we learned from that, and then highlight what we did with that and how we really put that into evidence-based and best practices. And at the end, assuming we have a few minutes left, we'll do a little bit of Q&A. So to start with, just to kind of orient for our organization, I thought it would be important to bring forward what Banner looks like. We are a care and coverage company, and we have a lot of assets that span that entire portfolio. In the state of Arizona, we're the largest healthcare delivery entity, as well as the largest private employer within the state. Historically, we've been known a lot for our acute care hospitals, which are listed there, urban hospitals, critical access hospitals, teaching hospitals, et cetera. But we also have specialty hospitals, so children's, behavioral, cardiovascular. Our ambulatory portfolio has continued to grow over time to meet the demands and the needs and wants of our patients that are out there in the community. So you can see that we've been building that so that you can get care where you want it, when you want it, and in which part of the continuum you need it. So urgent care, ambulatory surgery centers, et cetera. Post-acute remains a very significant part of that portfolio as well, and we've got joint ventures to help meet some of those needs, as well as a very large home health division, again, trying to bring care to where patients need it most. Centers of excellence, plans and networks is a part of that coverage, and we believe that by marrying the care and coverage parts together, we provide an ecosystem for patients to make it a little bit easier, and then ancillary services kind of round all that out. While Arizona is the biggest component of where we deliver care, we're in 6 states in total. You can see those listed at the bottom. So let's talk about sort of our current state and our why. I think as you all went through morning sessions and our subject matter experts in many of the aspects of well-being and burnout, you know many of these statistics. But it's important to understand that they currently still represent our current state and a lot of our purpose and our mission-driven activities around this and our why. So sad to acknowledge that even despite everything that was done, the trials and tribulations, the pandemic, we still have about half of our physicians being burnt out. That is a staggering statistic. Juxtapose that to many other professions, physicians remain the most burned out profession that we can measure and acknowledge, which is, again, a staggering statistic. But one of the most staggering ones, of course, on this is the number of suicides that happen from physicians, approximately 1 per day. And I think that makes it incredibly personal for those of you that are in the audience, as well as the community at large. Without a show of hands, I think if you just think about your experiences over the years, it is unlikely that there's anybody in here who has not been touched personally, whether it's 1 degree of separation or a couple more than that by physician suicide. Not only is that significantly impactful to any of you who are professionals in the healthcare sector, but also those that are colleagues around that individual, their family, their support network, and estimates of what that leaves in the wake is over 1 million patients every year who also lose their physician. Very, very impactful. All of those on the left-hand side continue to contribute in that big gap that you see on the graph. We have a tsunami of unmet needs. Not enough trained, highly professional individuals to meet the needs of our communities, and that continues to widen. Not having a very well workforce is going to continue to contribute to that in many different ways, whether it's the suicide statistic that I just mentioned that leaves 1 million patients in need every year, individuals who are retiring early, or just individuals who are perhaps not quite as good at their job with engagement, delivering quality and safe outcomes, and really being able to connect with those patients. So as we did this work, we wanted to really create some very bold vision. And so you can see those here. We want to live with purpose. We want to have a culture of healing. We want people to be inspired through collaboration. And we do want to create those magical, memorable moments. That's not just a phrase. We know when we see it, we know when we feel it, and we just reflect so fondly when it has happened with us or to us or in somebody else that we're able to see, experience that. We want those moments to be plentiful. And of course, we know that highly engaged individuals talk a lot. They talk to their peers and they help us create the ongoing bold vision of possibility in this space. So I mentioned at the beginning that of course we started with listening, very important component, and we listened in many different ways and in many different spaces. We are very, very diligent about measurement. So we go through multiple survey cycles, general team member engagement cycles, safety, and of course, burnout cycles. But in addition to that, you have to get out and about. You've got to get deep into the workflow. You've got to get deep into the clinical spaces to make sure that you are listening and learning from everybody. We also do a lot of comment analysis. So of course, we enjoy the standardized reports that we get from standardized surveys, but the comments are also very rich. And with better tools, we now don't have to read all of them, and they can be put through an AI algorithm and summarized and themed out for all of us. But in addition to that, doing focus groups and interview of individuals is also a very important piece of that. So as we did all that, kind of put it into the funnel and did some affinitization and prioritization, we ended up with these 5 themes. And you can see new provider onboarding, professional development, leadership development, well-being and professional fulfillment, as well as unique contributions. One of the other things, though, is on the very bottom of the slide that we thought was incredibly important. We want to do all of these activities from hire to retire, making sure that we're paying attention to every component and aspect of a professional's journey with us. And so you'll see as we talk about some of the programs that we have in place, how we've been very intentional about making sure that we're spanning that entire continuum for individuals to come and want to work with and for us. So I'm going to start with new provider onboarding. This is incredibly important, and there are a whole bunch of activities that you can see there that we do. Checklists, making sure that we're being incredibly diligent, that those first touch points are very, very, very good. Let me read to you a couple of statistics about the importance of this onboarding. Physicians who have a great onboarding experience are 69% more likely to stay 3 years. Okay, just think of what the return on investment of that is. They are also 18 times more committed to their organization. And we know that commitment to organization manifests itself in many other positive ways for the well-being of the enterprise. Individuals who are committed to their organization and engaged are more likely to create quality experiences. Quality experiences are more likely to deliver better financial outcomes, better patient experiential outcomes, and again, that engagement is a positive feedback circle. Those with a great onboarding experience are 33% more engaged, achieve proficiency 4 months earlier than those that are not, and are 50% more productive. There's a whole bunch of return on investment within that. And this is one that will really, I think, catch everybody. 86% of a new hire's long-term commitment occurs within the first 6 months. So once you've kind of missed that first 6-month opportunity, even if you double down, triple down, quadruple down, there's a lot to make up for, and you probably will never actually do it. So let's look a little bit about professional development. And these are highlighted here. Anything that you see in my slides that has a nice little yellow star on it means that there's a beautiful poster out there in the hallway right behind. So kudos to the Banner Health team that did 2 of these posters. But I want to speak a little bit about ongoing professional development and how important it is to invest in that for the well-being of your physicians and APPs. On the upper left there, we decided to not build it ourselves. We actually went out and bought a clinician experience project to help with that professional development. Not everything probably should be done by your own organization. Deference to expertise and going and hiring and buying some of that can be very, very, very impactful. On the bottom left, you can see coaching and that kind of development is a very important component of our totality of our developmental offerings. Another poster out in the back, if you have time in between things, is about the Women's Clinical Leadership Network. I think we all know that having subsegments of your physicians and APPs is also important, making sure that collegiality around individuals who might be experiencing like ups and like downs of their career path is very important, and this has been incredibly impactful to all of them. And of course, always making sure that we're taking care care of others is a big piece, and that's depicted on the bottom right. Talking a little bit more about that, I'm just going to reflect back on what we decided. We started this work in like 2017, 2018, and we did a lot of literature search in addition to that deep listening that I spoke to. And we landed on using an evidence-based approach that was developed by Dr. Swenson. It's the Swenson model. And the thing that was very attractive to us about adopting this model is it's depicted on the right-hand side of the screen. It appeared to be very holistic, not just piggybacking on one thing that helps uplift well-being or combat burnout, but something that's very holistic across the entire enterprise. You can see there that there's 6 different themes within the Swenson model: leadership development, design at the system level, social community, and I'm going to talk about that in just a second, bolstering individual wellness, making sure that you're taking care of second victims, and removing pebbles in the shoes of those that have to walk each and every day. Just a little bit about individual wellness. I know there's a poster out in the back also from another organization. This is very important to do, but it can't be the only thing that you do. It's absolutely a foundational piece, but if you put sort of all of your efforts in that and are not thinking holistically, I don't think that you get the lift that you're looking for at the enterprise and holistically across your entire workforce. I want to talk about social community in just a second as well, because that's a really important piece, but I don't want to leave the slide without talking about the pebbles. The headwinds that are in the healthcare sector today are blowing incredibly harshly and at high volume. And the pebbles that we have to be constantly attended to. Take 3 out today and possibly 2, maybe even 4 come in tomorrow. So you've got to have a really good constant improvement cycle to make sure that you're out deeply listening, watching your metrics of how much time it takes to complete different tasks, and really making sure that you're getting those very good multidisciplinary work teams around all of those problems to solve as quickly as you can, because again, as soon as you take some out, some additional ones are likely going to go right into that sneaker. Social events are incredibly important, and I think there was conversation from some earlier speakers about the importance, right, of social connection and connectiveness. And this is one of those 6 themes from the Swenson model, one that's very important to us. And I'm going to highlight that by some statistics of how important we have found it to be for those that participate. So we know that these are very highly trained individuals. They work an enormous number of hours, and the amount of free time that they have for discretionary spending of that free time is actually very, very limited. We have put into place and sponsored, it's like a 6-figure type of investment for this, structured social events that are self-organized by our physicians and APPs with themes of accomplishments that they have to do at those social events. So it's not just go out and have a beer with your friend. This is structured activity around themes with learnings and capturing of those learnings. And these are incredibly popular. So I'm going to go through just a couple of statistics about these, but look at that one at the top right. In 2024, pretty busy year, right? Across all of us, we're pretty busy in the healthcare sector. 60% of physicians and APPs participated in these. These are all off hours. Saturday, Sunday, evening, breakfast, golf. You can see all the different types of pictures that are there. Going back to 2021, sort of at the height of the pandemic, if you will, over 50% of our physicians and APPs participated in these activities. I think those type of statistics really speak for themselves around how much social community coming together around themes and discussion that are structured really are meeting the needs of these individuals. You can see the event types that are listed there. I believe that we're on pace in 2025 to probably at least meet or exceed that, which is, again, I think a testament to the sustainability of sticking to a very holistic model and making sure that you're paying attention and delivering each subcomponent of that year after year. Other things around well-being that are very important are not just what you can do outside from a social perspective, but what can you do inside the environment. We know that the environment of healthcare is very fast-paced, no matter which part of the continuum you are delivering. And sometimes people just need a moment to have a break. And so recharge rooms, a very evidence-based approach, has been another addition to the number of activities that we sponsor to really stay attuned to this. And you could take a look at some of these. We have 14 recharge rooms that are live right now. Almost 100,000 recharge experiences with team member sessions over 250,000 already. Recharge minutes are over 1 million, and look at the bottom of what has been reported as we do measurement around this as well. 62% average drop in stress, 39% increase in mood, 52% average increase in reported cognitive alertness, 98% likely to recommend to another colleague. These are, of course, immersive. They're multisensory. They include light, sound, music, visuals, and even aroma within the totality of the experience. Most individuals will spend, 15 or less minutes in that. And if you've never had the opportunity to go experience this, you really need to. I have had the opportunity to go out to almost all 14 of these recharge rooms and find each one of them to be incredibly impactful. If you are willing to just be all in for those couple of minutes and let all of that multi-sensory activity do its work with and for you. One of the other things about development that we found in our listening was the importance of making sure that we are saying thank you. Physicians and APPs often will tell you they don't need it, but they actually do, and they love it when they get it. So make sure you're paying attention to Doctor's Day, Happy APP Week that we just celebrated last week, sending out MVP cards, congratulations for retirement, and capturing all of that as you do that work. Making sure that unique contributions as a component of your totality of your experience are important. Mentorship programs, how do you deal with career transitions? Making sure that community contributions are captured. Do you have a project? Is somebody looking for a board member? Making sure that you have that repository and giving individuals an opportunity to do what also fills their cup. The message is always in the data. So you got to make sure that you are measuring what you are doing. There's huge return on this, and you've got to stay committed to the measurement, paying attention to the signals, and adjusting and tweaking over time. Turnover is a great way to demonstrate how these investments give you return. And we all know it's very expensive to have a nurse, a physician, or an APP turnover. We all experienced, I think, very similar things during the pandemic. Nobody changed any jobs during it, and then after it, there's a lot of movement. Our benchmark, we do physician and APP turnover together, is probably maybe just right about slightly above industry average. Burnout, we use the MBI, is well below industry benchmark. We are at 8.8%, with average being 9.9%. Self-identified burnout, a very important component of taking a look at this. We had a very significant drop, 2024 to 2025, 36.7 down to 32.5. Great Place to Work is part of what we do for our team member, and physicians and APPs take that as well. Very nice increase, 2024 to 2025, but the engagement, I think, speaks for itself. The one all the way over to the right, take a look at that jump from 2024 to 2025. Not all of that is only reflective of the work that I'm speaking to. There's a lot of other activities of making sure that we have engagement, but to drive home the return from that, we know that engaged employees, engaged physicians and APPs deliver higher quality. Unengaged physicians and APPs are more likely to be involved in a safety event with a patient than those that aren't. We know that trust and feeling safe as a patient is one of the biggest drivers of the experiential component for a patient, which then leads to your brand recognition and your attraction for other patients to come and see you. So the return on investment as you measure is very much on many of these metrics and can be translated to make sure that you're continuing to invest. I started at the beginning of talking about the statistics that are important here. And I was personally touched by the suicide of a physician colleague very early in my career. That experience has stuck with me for all of those years in the aftermath. I always reflect back, what's the difference between somebody telling you that they're having a problem versus somebody just blowing off steam? Do you have enough resources to be able to understand the difference between that? Do you have enough moments in the day to pause and make sure that you're reflecting on that and analyzing that as well as you possibly could? My experience was long before many of these programs came into place. And I certainly wish I could go back in time and know what I know today and apply it to that situation. I think there could have been a different outcome. So my pay it forward advice is given free to everybody so that hopefully many less of us have to go through that experience. Do it now. No reason to delay. The returns are absolutely there. Commit to it. It has to be an organizational commitment, and make sure that you're measuring it. Measure it qualitatively and quantitatively. Both are incredibly important. If you're out rounding and nobody's talking about your recharge room, something's wrong. If you're out rounding and nobody's talked to you about the social event, something's wrong. You do have to invest, obviously, to get the return, and you've got to try and find a way to make it just a little bit easy. In closing, we just finished our tripartite survey, and we do allow for individuals to put in free text comments. So I'm going to just leave this one for you to read of somebody who took one of our surveys for burnout, and this is what they said. And I want to thank everybody who works within this work for Banner Health of helping us bring this to light, helping to keep the vision be highly inspirational, and helping all of us as we have the same headwinds come together and figure out what are these best practices and how do we put them into place for the well-being of the entire healthcare sector so that we can all serve our communities in the absolute best possible way. Thank you.